With an estimated 1,000 eye injuries occurring in the workplace a day, it is extremely important to know what to do if an injury occurs. The most important way to avoid injury is to wear the appropriate protection. Yet when an injury does occur, you should know what to do. What conditions could result in an accident? Perhaps you work around chemicals or processes that could splash or release hazardous vapors or dust into the eyes or on the skin. Emergency eye washes and showers are crucial in minimizing damage to the eyes and skin where corrosive chemicals are used. You should be trained and informed by your employer about the different eye wash and safety showers available in your workplace. The selection and placement of emergency eye washes and showers are among the most crucial steps your employer can take toward emergency response. OSHA regulations require that emergency wash fixtures be provided at the workplace if there is a reasonable risk that an employee may be exposed to chemicals or other hazardous substances. The American National Standards Institute, ANSI, developed and established regulation number Z358.1, a detailed criteria for emergency eye wash and shower equipment. This standard established the minimum requirements for eye wash and safety shower installation, maintenance, and training in order to assure a minimum level of first aid for workers. Once a chemical is in your eye, it will continue to do damage until it is removed, diluted, or flushed out. Therefore, the most effective first step in treating chemical contamination is immediate flushing or washing with potable water for at least 15 minutes. Before selecting emergency fixtures, the potential chemical and operational hazards in the workplace must be first identified and evaluated. Then, when selecting fixtures, it is important to choose units that function uniformly so emergency procedures are consistent throughout the facility. With the help of trained medical personnel, first aid procedures for all types of injuries should be established and then reviewed and updated on a regular schedule. Manufacturers offer an extensive range of emergency eye wash and shower stations. It is up to your company to choose those that meet the requirement of individual work sites. One type of equipment that is commonly used to flush the eyes is the plumbed eye wash unit. These fixtures are permanently connected to a potable water source and have a small basin on which two small eye wash nozzles are mounted at angles that direct a gentle stream of water to both eyes. These units are also either freestanding or mounted on the wall or countertop. According to the ANSI standard, emergency plumbed eye wash units should be in clearly marked locations that require no more than 10 seconds to reach or within 100 feet of work site or hazard. The National Safety Council, the NSC, recommends placing eye wash units within 25 feet of hazard or work area to ensure immediate treatment. Pain and obscure vision will slow the response time, so it is vital that emergency fixtures be close to the hazard and highly visible. The NSC also recommends that the units be placed in a location within normal traffic patterns to simplify access. Plumbed eye wash units should be capable of delivering enough water for 15 minutes without requiring the use of the operator's hands. Most eye wash stations are activated by pushing a flag or foot treadle. When depressed, the water is released and the user is able to have their hands free so they can hold their eyes open and focus their attention on the emergency procedure. ANSI recommends weekly testing of emergency fixtures to verify proper operation and to flush contaminants from supply lines. In extremely hazardous environments, eye washes should be tested daily. It is also required that eye washes have caps to protect spray nozzles from airborne contaminants. Another eye wash system is the pressurized, self-contained eye wash. These are used in locations that can't be served by an eye wash station that is plumbed. However, they function similarly to plumbed units. These fixtures contain their own flushing fluid, which is replaced after use and must contain an antibacterial agent to prevent the growth of fungi, algae, and bacteria. These systems should also be clearly located and within 100 feet or as close as possible to the hazard or work site. Again, location is critical to ensure an immediate response. Changing the fluid and inspection should occur weekly by flushing the line and should be in accordance with the manufacturer's guidelines. A combination shower and eye wash unit is also available in case of chemical contact with either the skin or eyes. This type of emergency station offers the functionality of both the shower and eye wash in one location with one set of plumbing connections. Each unit may be operated separately or simultaneously. This system should be connected to a plumbing system that is capable of supplying adequate flushing fluid to meet the 15-minute requirement for both the eyes and body. Both the individual shower and eye wash should meet the ANSI requirements for individual fixtures. Weekly activation by flushing the line is recommended to ensure proper operation. Both the eye wash and shower should be able to deliver water continuously for 15 minutes. In many cases, it takes that long to dilute the hazardous material to a safe level or wash it out of the clothing or body tissue. Installation should meet proper plumbing practices with supply piping adequately sized to meet both flow requirements. Medical and industrial experiences have shown that the initial first aid treatment for a chemical splash should be to wash your body or eyes or both for at least 15 minutes prior to medical treatment. Your employer will survey the hazards in your workplace to determine the appropriate eye wash and safety shower systems for the facility. Again, all employees identified at risk of exposure should be made aware of the function and location of emergency fixtures as well as receive regular training. Eye wash and safety shower systems are not a substitute for proper primary protective devices. They can, however, reduce injury to your eyes and skin when used properly. Before working, make sure you are familiar with the type, operation, and location of eye wash and safety showers in your workplace. It could save your vision, prevent serious skin damage, or even save your life.